Welcome to my YouTube channel. Thanks very much for the subscription. For those ones who subscribed, those ones who have not yet subscribed, please do one thing: subscribe, put on a notification, and we'll continue to learn. Today we are going to discharges that our ladies, our sisters, our girlfriends, our mothers get, and what it means. So this discharge is a yellowish to greenish discharge. So someone might ask, doctor, when I'm having a yellow discharge, what does it mean? A yellow discharge doesn't necessarily mean that you are having an infection. It could be due to a mixture with some blood that is premenstrual, when someone is having a yellow discharge after menstruation. So it could, when the uterus is clearing up, it produces some fluid which mix with the normal vaginal discharge to give that pale yellow color. So when it is already yellow color and is not accompanied with other symptoms, it could not necessarily mean that there is an infection. But when it is turning from pale yellow to thick yellow, turning to greenish, it implies that there is something which is going wrong. And in most cases, it's the bacterial infections, it's the bacteria that normally bring about the yellowish greenish color. What is the differential diagnosis for this color? We have one, bacterial vaginosis, we have trichomoniasis, we have chlamydia and gonorrhea infections. Those are the 4 differential diagnoses of the yellow greenish discharge. How do I distinguish that I'm having gonorrhea? How do I distinguish that I'm having chlamydia, trichomoniasis, or bacterial infection? So, bacterial vaginosis is not a sexually transmitted infection, but these other 3 are commonly sexually transmitted. How do I know that I'm having bacterial infection? What are those symptoms that are going to distinguish these infections? 1, when you're having a bacterial vaginosis, you're going to be having a foul smell, a foul fishy smell, in most cases after sex. Bacterial vaginosis, which we saw up, is caused to alteration in the normal amount of the normal bacteria. You know, down there, the ladies have bacteria, the normal flora. But if it is interfered with, we are going to get those infection causing bacteria, pathogen bacteria. They are going to cause what we call bacterial vaginosis. Gonorrhea is caused by a bacteria called Neisseria gonorrhoeae. What are the symptoms of gonorrhea that distinguish it from chlamydia and other infections? We are going to be having unusual discharge, which is yellowish to greenish in color. We are going to be having burning sensation during urination. Another symptom is going to be bleeding between menses and bleeding after sex. A lady will also experience lower abdominal and pelvic pain. That could not possibly tell that you have a bacterial infection, that is gonorrhea, unless you go and do the laboratory test, and that is a culture and sensitivity to isolate this species. Chlamydia infection. Chlamydia infection, it brings a yellow to greenish color, and sometimes to brownish color, and there is itching, vaginal itching, valvular itching, there is anal pain, and sometimes anal bleeding. Rectal, in the rectum. Remember, the rectum is connected to the anus. So what goes from the rectum will go direct. So someone might be experiencing low abdominal pain, bleeding between menses and after sex, and burning sensation while urinating. So when we go to trichomoniasis is going to present with pruritus, vaginal pruritus. We are going to be having valvular irritation and a foul smell. But a fishy smell is typically for bacterial vaginosis. How do we treat these conditions? What is the best treatment and management of these infections? When I am having a yellow-greenish discharge, I do a culture sensitivity test, and they tell me that I am having either gonorrhea, I'm having chlamydia infection, I'm having trichomoniasis, or bacterial vaginosis. What is the, after getting the definitive diagnosis, what is the best treatment for these conditions? Watch out for the next video. I'm going to be talking about how we manage these infections. What is the treatment for these infections?